Well, welcome into To Your Health, and To Your Health happens when you can have an active lifestyle. That's an important key to your good health. And to have that active lifestyle, you need to get up and moving. The best way to move is with your feet. So we brought in two experts in the area of feet, called podiatrist Dr. Brian Kille and Lashonda Kille. And your Greenville Foot Care is the name of the company. But basically, even though you're in Montgomery, you're in Greenville.
I'm in Greenville. He's in Montgomery and Greenville.
Right.
Yes.
Okay. Did the company start in Greenville, or did
It did. That's
okay.
how we got
That's
the
how you
name.
get the name. Okay, it's
Yep.
a good way to do it. Well, last week we talked about making sure you're wearing the proper shoe, in no matter what you're doing. If you're exercising or even just going shopping or doing the right thing to be comfortable. And you talked about the fact that when your foot is sliding in that shoe, you can cause problems to your feet. What if we're not doing the proper things with our shoes? What are some of the problems that we can encounter coming out of that?
Well, all right, we'll start with the sliding problems. The longest toe will generally slide and jam that toenail into the shoe, which can lift it up at the back of the nail, called the proximal nail fold, and lead to infection, bacterial or fungal. It can also lead to traumatic nail thickening. And traumatic nail thickening is one of those phenomenon where the nail plate will get really thick and hard to deal with in the absence of fungus or any other pathology.
Yeah, we see that really frequently. Like the first thing you'll notice is there'll be like bruising under the nail. And
Right.
that's what I generally see, like when the patient comes in, they'll say, well, my nail is black right here, right back here. And I look at their feet and I look at their shoes. And then I ask, what shoe size do you normally buy? And they tell me. And then I'll have the nurse measure. And it's always off. It's always off. In fact, she has learned now when she sees a bruised nail to get out the Brannick device and measure. And so nail thickening in the absence of fungus, I mean, there's nothing you can do for that.
Right.
So, if you have a fungal nail, then you can treat it with antifungal. But if it's just thick because you're wearing the wrong shoes, then there's...
So once that happens, you're going to live with that thick nail for the rest of your life, pretty much.
Or you can have the nail permanently removed.
You can have that surgically removed. But,
right.
And the second toe is most common.
So I'm speaking as a person knows nothing about this. When you have that toenail removed, do you put in a fake toenail, or do you have to?
Some people do.
I don't, but yeah, I've had patients do it.
Or does it grow out a new toenail?
You can have a nail removed, and if you don't take measures to prevent the nail from growing back, it will grow back. So if you have a nail that's thick because you wore the wrong kind of shoe, then it will grow back that way. So we try to take measures to hopefully prevent the nail from growing back. And you don't need your toenails for anything.
Right.
Really.
They don't really do anything.
They don't
anymore.
really do anything.
Okay, so they don't protect underneath it.
No.
Okay.
That skin, once you take it off,
that is just skin, right?
Right.
Yeah,
And then
much.
it sort of hardens.
it hardens up
And
afterwards.
it kind of looks
yeah.
similar to a toenail anyway. And I have patients that just sort of paint that skin.
okay.
And
Yeah,
it
I've
just
seen them
doesn't
paint.
really look different.
I have had ladies put acrylic nails on top
They
of
have.
the skin that hardens after a toenail removal.
Isn't that something?
Yeah.
Well, I've learned something brand new right now, just right now. So other serious conditions happen then?
So a shoe that's too short can lead to crinkling of the toes, which will throw off the balance of the tendons, leading to hammer toe deformities. A shoe that's too narrow, so squeezes too hard in the forefoot, can lead to those neuromas that we talked about a couple months ago.
Yes.
Because it's causing that forefoot to squeeze and push those nerves to the ground, so that you're causing trauma to them. A shoe without enough cushion or can lead to heel pain and issues like that. Because when you come down and strike, if you've got nothing there but the floor, then you can damage those ligaments and other structures. So all those kind of things, biomechanical imbalances, can lead to bunions as well.
So some people already have, a foot that's not so straight or toes that are not so straight to begin with. And then you add an ill-fitting shoe and it's just going to worsen that condition. And then you can get painful bunions, and then you can get corns on your hammer toes. And we talked about nail trauma before, and trauma to the nails sometimes can cause or create a condition where you will develop nail fungus. So just buying the wrong pair of shoes can really cause a lot of problems.
Okay, before you get out of here, last week we talked a little bit about shoes. A lot of times now, especially in the South, I'm originally from Chicago. In the South, a lot of times men especially will wear a loafer kind of shoe with no socks. I mean, and that's a regular dress shoe, but they're worn without socks. How important are socks in the equation, and should you always put on socks with shoes? And is it okay? I mean, obviously with sandals, you don't normally wear socks.
That's his pet peeve. I don't know if you heard him say oof.
I heard him say,
Yeah,
oof.
it's definitely my pet peeve to wear closed-in shoes without socks, because you're just asking for a fungal infection.
Okay.
You got to remember that
That's right, because you're going to sweat into that
you're
leather.
going to sweat into the leather. And what is fungus like? Warm, dark, and moist, right?
Yes.
Just like your
All of the above.
your backyard in August. You go
Yeah.
to bed, right? You get mushrooms.
Yeah.
You put your foot in one of those sweaty shoes at 100 degrees.
You
get
get
There you go.
mushrooms.
Yeah, you get mushrooms. So there you go.
Okay.
I never recommend wearing shoes without socks that are closed.
And they make no-show socks for men now.
Right.
For
Yeah,
a
they
long
do.
time, they were just for women. They're just like this little
Yeah, it's on
thing
your...
that you just put on your toes and your heel, and you still can't see the sock, but it's still better with wearing.
Than do it when just going barefoot.
Exactly.
Now, I do have people ask me about color versus white socks. Now, in the old days, that the colors tended to run, but they don't do that much anymore. So
Right.
as long as your sock is cotton and can absorb sweat, really color
So
is not an
basically, your
issue.
best thing to look for a good cotton sock.
Good cotton sock rather than
Right.
that old, what was it, rayon or
Yeah,
nylon or
acrylic
whatever.
or
Yeah,
whatever.
whatever
Yeah,
it was.
God
Just
only
add a
knows what
little
it
bit
was.
of everything in there.
Okay,
Yeah.
before we close, obviously you don't need a referral from your regular doctor to come see either one of you.
Oh,
As a general rule, no. There's only like one insurance that requires it.
Okay. So I mean, if our viewers say, okay, I'm having some problems, I'm going to tell our viewers it's worth your while if you're feeling any kind of discomfort or anything with your feet, to at least go and get them checked.
absolutely.
And find
Absolutely.
out if it could, because you can nip it in the bud, so to speak, or
Right.
nip it in the toe.
Nip it in the toe.
No, nip it in the toe before you go any further.
And if you're diabetic, you
Yes.
should have a foot exam at least once a year. That's very
Okay.
important.
That's good. I'm
By a
diabetic, and
podiatrist.
nobody's ever told me that I should do that.
Really?
Right. So I'll be in to see one of you guys.
There you go.
Amen. Okay, well, thank you. It's Greenville Foot Care, and of course, you can call me if you need any information, but call them directly. We're going to put their phone number. They've got a web address also, and we'll be right back right after this.